Healthcare in America. President Trump is rolling out a Medicare plan today, heading to Florida, where he's expected to sign an executive order affecting the federal agency. This is his 2020 Democratic rivals unveil sweeping and expensive plans to overhaul the healthcare system. Joining me right now for the first on Fox Business interview is Health and Human Services Secretary Alex Azar. Mr. Secretary, it's always a pleasure to see you. Thanks so much for joining us.
Thanks for having me, Maria.
So what are you expecting that the president will unveil? This is a proposal to strengthen Medicare, but I'd like to ask you the details in terms of why he's focused on Medicare Advantage, this alternative that's being offered.
You bet. So today the president's rolling out an executive order that will strengthen, protect, and improve Medicare for the 60 million seniors who depend on it. And that includes the almost 1/3 of seniors who have Medicare Advantage. Those are the commercial plans that seniors can choose that operate really like your and my insurance as opposed to old-fashioned Medicare. Increasingly popular among our citizens, growing very rapidly. It should be approaching 41% eventually in the next year in terms of Medicare Advantage enrollment. Now, a lot of the proposals for Medicare for All, what they would do is actually take Medicare Advantage away. They would outlaw private insurance, and this is what our seniors want. What the president's doing today is putting a stake in the ground, saying he's going to be the one defending and protecting Medicare for our seniors. He's going to be improving Medicare, and he's not going to let anyone touch their Medicare that hurts them.
Yeah, I mean, you make a good point, but of course, Medicare for All is the prevailing solution. When you look at the Democratic hopefuls, this most recent debate was all about that. So what can you tell us about their plans and why you believe that they are wrong-sided?
Well, I'm not going to comment on political parties or individuals. I can just talk about the policy ideas of Medicare for All.
The policy.
So the core problem with Medicare for All is it's really dependent on getting rid of private insurance. And what President Trump's fighting for is personalized, patient-centric care that puts you in control and treats you like a human being and not like a number. Well, what could treat you more like a number than government-run health care that undermines Medicare for our seniors, reduces access to doctors and hospitals, creates a two-tier system of health care as the best doctors and hospitals flee from the system? Because, you know, right now our seniors get a really good deal. Why? Because Medicare actually underpays, and the commercial market effectively subsidizes the access of our seniors to doctors and hospitals. Well, if you put everybody on Medicare or make Medicare available to everybody, that gig is up because it gets spread across 330 million Americans, and the doctors and hospitals will flee, as they have done in other socialist systems around the world. And that's what President Trump is saying is not going to happen on his watch.
That's a good analysis that you just made, actually. You made it clear, and I also want to point out that right now 180 million people get their health insurance from the public markets, and Medicare for All obviously wipes all of that out for Medicare for All. Look, the president has talked a lot about making drugs more affordable. You've got certain life-saving drugs that are really they can't even be accessed by some people. $100,000 for one round of drugs. This plan that he's going to do and with executive order is also allowing for cheaper generics, right? What can you tell us about its impact on the price of drugs?
Yeah, so the president's initiatives in Medicare have brought close to $500 million of savings to seniors. $320 million of that savings have been for seniors' access to drugs. By lowering what Medicare pays for drugs, we have lowered what seniors pay out of pocket for those same drugs. We are also giving tools to health care plans to increase generic utilization, to make generics cheaper for our senior citizens. And that's part of what's been driving health care costs and driving drug costs down in the United States for the first time in 51 years.
Let me turn, Secretary, to the vaping epidemic in America. Today, the CDC is going to be releasing new numbers connected to this crisis as the Mayo Clinic study finds that toxic chemical burns in 17 vaping patients resemble mustard gas injuries during World War I. This is getting scary. How serious is the issues around vaping?
So I want to separate the vaping issues you just talked about from the other issue of e-cigarettes and nicotine addiction among our youth. But this vaping issue and lung injuries is very serious. People are using vaping instruments, and the majority of the cases that we've seen involve them using pods that have THC, the active ingredient in marijuana, but they have other products in them. You don't know. This is not a regulated industry. You don't know what you're getting. You do not know what toxins you are vaporizing and putting getting in your lungs. Listen, as a general health matter, don't put stuff in your lungs. It's not good for you. And putting vaping materials into your lungs puts you at risk. These products are off-the-street things. You are trusting just anybody selling you something, and we're trying to get to the bottom of what the chemicals are that may be causing this lung toxicity. We still don't have a complete answer for every single case. We see cases where vitamin E acetate, which is basically an oil used in face creams, a vegetable oil, has been used to cut the THC. That gets vaporized, gets in the lungs, creates lipoid pneumonia, basically an oil in the lungs. But there are other things going on here that we can't completely explain all of the cases we're seeing. So please be careful. If you're a vapor, be careful with these off-the-street products or anything that might be adulterated.
Yeah, you make a really good point on this vitamin E oil that a lot of people are saying is part of the issue. But then how does that jive with the idea that marijuana is being legalized in so many states across the country?
Well, it just shows buyer beware here on this, that when you get a product to use something illegal like THC to basically get a high through vaping, you're doing something that's against federal law, and you're getting products that anybody could have put anything in them.
Yeah.
Could have cut the product to make money, to thin the product, to just make a little more change, and you're the victim of that. You are at their mercy. Very,
very important commentary from you, Secretary. Let me ask you about Walmart now testing health-focused programs in select markets for existing medical plans to reduce healthcare spending. How important is the private sector in addressing the pricing issues for healthcare, and are we going to see more from the private sector trying to approach this?
Well, I'm delighted to see the innovations that Walmart is bringing, as well as the other innovations that the private sector are bringing, because, of course, we, the government, do not have the solutions to health care. We're usually the cause of the problems. But what Walmart's doing is very consistent with what President Trump is trying to do in health care, which is to give a helping hand to people through our health care system. You often feel as an individual alone to navigate the system, and we're redesigning our health care system, Medicare, as well as our other programs, so that people who have to navigate that system have a helping hand. They feel cared for, even as they're in control, that they have aligned incentives with, say, a primary care practice that will help them navigate through the system and get better health outcomes by common incentives. So very much aligned with what Walmart and other private sector entities are doing here, and I applaud those efforts. Well,
you also have J.P. Morgan and Berkshire Hathaway and Amazon trying to come up with their private solution. We haven't heard much about that. How are they working with government on their plans, and what are they trying to accomplish?
So, Maria, I haven't heard much from them about where they're going yet. I am more familiar with where Walmart is going, and very excited about the changes to the health system there.
Mr. Secretary, it's always a pleasure to see you. Thanks so much.
Great. Thank you, Maria.
Secretary Alex Azar this morning at the White House.